It's my pleasure to be here and to speak about this partnership between the American College of Physicians and Consumer Reports. Just to give you a little bit of background, I'd say approximately 2 years ago, the American College of Physicians started an initiative which we call our High-Value Cost-Conscious Care Initiative. And the idea behind it was to identify those areas of overuse and misuse of care that do not benefit patients but add to costs. So although cost is one of the important concerns and one of the important things that we can get out of this initiative, in fact, what is really driving it is to optimize the quality of care. We started with some papers that were published in the Annals of Internal Medicine in February of 2007, a paper that had an overview of high-value cost-conscious care, as well as an evidence-based paper, a guideline on imaging for low back pain. Now, I should say that we feel it's important, it is a professional responsibility of physicians to be reducing areas of overuse and misuse of care. And as we looked at this, it became clear that what we educate physicians about also needs to have a component relating to education of patients. And it is because of this that the partnership with Consumer Reports is so exciting in our minds. Patients are clearly one of the audiences for our high-value cost-conscious care campaign, and it is therefore important to have the appropriate vehicle to get information to them, and Consumer Reports is an absolutely wonderful opportunity for us. As Virginia mentioned, the first two topics relate to imaging in low back pain and also the use of medications for the initial treatment of type 2 diabetes mellitus. The clinical resources that we develop at ACP, which are being used as the focus for Consumer Reports to develop its patient-related materials, the clinical guidelines that we develop come through a very rigorous evidence-based process. So our clinical guidelines committee does a detailed review of the evidence, the literature that is out there. They develop a set of recommendations. These recommendations are then written up as a manuscript for publication in the Annals of Internal Medicine. All of the recommendations go through our Board of Regents, which needs to approve the recommendations before they become official. The recommendations in the manuscript also go through the editorial process of the Annals of Internal Medicine. So there is a very rigorous review process before the kinds of clinical recommendations that we put out are actually accepted. And it is with this background that we then give these materials over to Consumer Reports for development of patient-related materials that will translate the information into a format that is appropriate for patients. So overall, we're really quite excited about the initiative, and I will now turn it over to Kevin.